I am thrilled to introduce Dr. Marc Harrison to this group today. And I want to tell my business students, but it's got to apply to the School of Health too. I met Dr. Harrison about 5 months ago because I serve on the community outreach of the Orem Community Hospital. And he came to meet with city leaders. I think some of you know I'm a city council member in Orem. And I just had a wonderful time visiting with a man who's articulate, who leads a group of 40,000 employees, who has revenues of a whole bunch of money. I don't know if that's public, but it's a nonprofit entity. They're doing so much good in the community. And he said, is there anything I could do to help you? And without a second hesitation, I said, could you come speak to the students at Utah Valley University? Whatever you do professionally in life, don't miss that opportunity. When you see someone who can help fulfill your mission, don't be shy to ask. I don't know how much of an introduction Dr. Harrison needs. We posted it on Canvas, and I hate to take too much time. I will say he has some colleagues here with you who will help answer questions after. Dr. Harrison has had some health issues that he's going to address, so he is not unfriendly, but he will not be shaking hands as a way to keep himself healthy and strong and allow him to grow. He's the president and CEO of Intermountain Healthcare, is a pediatric critical care physician with a proven track record as a top operation executive on a global scale. We are so lucky to have him in Utah. He has served as a CEO of the Cleveland Clinic in Abu Dhabi, Chief of International Business Development at the Cleveland Clinic, and Medical Operations Officer of Cleveland Clinic. He received his undergraduate degree from Xavier College, I thought I said Harvard, I stumbled a little bit. Well, we can give you an honorary degree from there. We have that power, don't we, President? His medical degrees from Dartmouth Medical School, completed a pediatric residency and pediatric care fellowship at Intermountain's Primary Children's Hospital, and a Master's of Medical Management at Carnegie Mellon University. By the way, you should know that our own good president, Astrid Tominas, is here. President, you want to they know who you are. We're thrilled to have President Tominas with us. You got an applause with no speaking, President. That's pretty darn good. She will be sneaking out just a little bit early, but we're thrilled to have her with us. Dr. Harrison is an All-American triathlete and represented the U.S. at the 2014 World Championships. Will you join me in welcoming a great man and a great speaker, Dr. Harrison?
Thank you very much. It's really quite an honor to be here. I think I said yes to coming and visiting with your students in about 10 seconds, right? Because
the longest ever.
Yeah. Can I ask you guys a favor? Can you flip your laptops down? Can you put your phones away? Can you be fully present for the next 40 or 50 minutes? If you don't, I'll call on you. Okay? Yes, sir.
We're supposed to take notes while you speak.
All right, then if it's for work, I always say at our place, if it's for patient care, do whatever you need to do. So if this is for work, do it. But let's not tweet or whatever in here, okay? All right, thanks. Fair, is that fair enough?
Yeah, but I can help the students, I think. You can just remember as much as you can and take some notes after. If he's requested us to shut our laptop, we're happy to do that. You can take a few notes, and we won't be quite as tough on you on grading this time, okay?
All right. But if you do need to do something, I don't ever want to be the person who stands in the way of you and your education. I have a great deal of admiration for this organization. I love the mission. I had the great pleasure of visiting with your president a little bit before our session together. And boy, do you have a great leader with huge aspirations for the organization, but unbelievable belief in all of you and your potential. And that's one of the big secrets to success. So you heard I have had a little bit of a bump in the road from a health standpoint, and let me talk about it. It does, in some ways, inform how I approach the world. And so I have cancer. I've got a cancer called multiple myeloma. It's the most common blood cancer, more common than the leukemias, lymphomas, etc. It's not curable. Boy, is that a tough thing to hear, right? Fortunately, it appears to be something that is manageable. But when you think about your opportunities to make a difference, in some ways this is a good thing, right? Because it allows us to, at our house, really sharpen our focus and to make sure that we live our lives in a way that we get to make maximal impact for the communities we get to serve for as long as that's going to be. Hopefully, although I guess I was going to say hopefully that's for a really long time. My wife did point out the other day that I'm worth far more dead than alive at this point. So, you know, I'll take that with a grain of salt. But I'm feeling great, but I did just have a bone marrow transplant, which I do not recommend as a recreational activity, okay, if any of you guys are wondering. And so I'm still immunocompromised, and to that end, I'm not shaking hands these days. So, the title of this talk is Ethics and Leadership. And so we'll talk a little bit about how I think about this topic, but I'm also going to want to hear from you right from the beginning so we can intersperse questions and answers all the way through this talk. So are you guys up for that? Better than getting talked at, right? Can we have a conversation? Do we have mic runners? Is that how we do things?
They'll shout them out if you don't mind repeating it for the camera.
Is that fair enough? Does it sound good? And I think we have until 20 past. I understand that an academic hour is 50 minutes. That's some weird economics, folks. I'm not sure I totally get that. I did point out that that is the same as a psychiatric hour. So this may count as your therapy as well as a lecture together. So let's talk a little bit about ethics and leadership for just a second. So this says, is ethical leadership the same as leadership that makes people feel good? What do you guys think? People conflate this all the time. He's a great leader. She's a great leader. Everybody loves her, right? Keeps everything the same. You know, we feel really safe and stable. Do you think that actually gets anything done in the world? No. In fact, there's somebody who I respect greatly who's served in some really prominent government positions, both at the state level and nationally. And what he said to me is, he said, you know, Mark, if you ever have an approval rating over 60%, you probably aren't actually trying very hard. I don't shoot for that, right? But, you know, I'm here to make a difference. I suspect you're here to make a difference. And the world's changing pretty fast, like day by day. And occasionally I'll say to folks who say, boy, there's a lot of change. I said, been to Blockbuster recently? Right? Actually, you guys are probably too young. Blockbuster was a video store, right? So what do folks like your president and like me, what do we try and do? We try and take a great organization, guide it through turbulent waters, have it get to a place where it's even more relevant than it has been before, and provide the people who work with you with opportunities to learn and to grow. The idea that people will stay in the same job for the rest of their life is really unrealistic. Did any of you all actually think you're going to be staying in the same career your whole life? So you're smart, right? In fact, I think if most of the folks in this room are millennials or younger, which is probably true, you're going to change careers, what, 3, 4, 5 times probably? And probably the core competency that you're going to have is, can you retrain? Can you learn to learn so that you can be relevant no matter what? So from an ethical leadership standpoint, we need to take on the tough stuff to clear the way for you so that you can be prepared to have really successful lives from a holistic standpoint. Spiritually, from a family standpoint, recreationally, but also the ability to put bread on the table for your family on into the future, and so that you can make a difference too. Any of you really happy with the polarization that you're seeing in the world right now? I'm not. I find it disheartening. But I think that those folks who are super polarized are actually the minority. I think most of us are folks who want to get along with our neighbors, who value thoughtful discourse, can disagree without being disagreeable. And I think that we can have businesses and we can serve each other in those ways as well. So I want to talk to you for a few moments about how Intermountain Healthcare is addressing some of these. So you can read this as well as I can. Can I give you a thumbnail on Intermountain Healthcare for just a second? I'm not going to presume that you guys know who we are. By the way, does anybody out there work for Intermountain Healthcare? Right, so we've got some of my colleagues out here. Anybody whose family works for Intermountain Healthcare? I'm not surprised. So it should be about 7 or 8% of the folks in this room are associated through employment one way or another. So we're the largest employer in the state by almost 2x. We serve half of Utahns every year, 75% over the course of a lifetime. We now have 23 hospitals. We have a virtual hospital, which we can talk about as well. We have boots on the ground operations in Idaho, Utah, and Nevada. By the way, if you go to Nevada, don't say Nevada because they'll correct you like right away. And we can talk about growth at some point if that's important to you, because I think that is part of ethics and leadership, is how do you have sustainable organizations. We've got about 180 practice sites. We have about 2,000 doctors and other practitioners who we employ, about 10,000 nurses. This is like the privilege of a lifetime, because we are a not-for-profit organization that serves the communities we're in, and we get to help people stay well, which is really the difference at Intermountain Healthcare between traditional healthcare systems, which are really predicated on churning volume. The more operations we do, the more money that gets made, or it's really about taking care of people when they're sick, which we do extremely well. I actually stayed at Intermountain for my bone marrow transplant. I had the privilege, I could have gone anywhere in the world. I stayed right here in Utah at home, and I got spectacular care. So we have a lot of problems here that we're responsible for as we try and keep people well. I won't ask you guys to raise your hands, but my guess is that everybody here knows somebody who's killed themselves. My guess is that everybody here knows somebody who's had a problem with opioids. I bet that everybody here knows somebody who's had a problem with violence in their family or in their neighborhood. In fact, for the first time ever in the United States, well, for a really long time since the Industrial Revolution, people were living shorter lives than this generation than the generation before. And the reason for this are deaths of what people call deaths of despair. Suicide, homicide, alcohol abuse, drug abuse, etc. And as an organization that has reoriented itself around keeping people well, this is a terrible thing, and we can make a difference, and we are making a difference. So how are we doing that? We could, so let's take guns for as an example, okay? And one of the reasons why Utah has a huge suicide problem, statistically, it's access to guns. It's the most lethal means of attempting suicide, well over an 85% completion rate for somebody who tries to kill themselves with a firearm. Okay? So we could get into the entirely non-productive Second Amendment, legalistic, highly political kind of conversation, or we could say this is a public health problem. And we've actually taken the latter approach. So we have a young woman whose name is Marissa Henn, for instance. Marissa is super smart. She went to the Kennedy School at Harvard. She got a PhD. She is as blue state liberal as you could ever hope to meet, okay? Her partner in preventing suicide by gun is a guy named Clark Aposian. Did any of you guys know Clark? So he's the head gun lobbyist, in essence, for the state of Utah. As pro-guns as possible as anybody you'd ever meet. These two people, opposite ends of the political spectrum, they share a passion for making sure that their friends and neighbors don't kill themselves with a gun. And they're collaborating. So this isn't waiting for the government to solve our problems. This is how do reasonable, thoughtful people who are unwilling to get involved in that highly polarized sort of discourse that is all too common, that tweet culture that's so brutal, they're collaborating. We've given out, thanks to them, 15,000 gun locks, many tens of thousands more to come, lots of education, and we believe we're starting to see a change in the suicide rate in the state of Utah. That's the right way of getting things done in our estimation. The other piece of data that I'll give you is around opioids. And we all know there's a plague of opioid misuse. Utah, who thinks it's in the bottom quartile, least likely to have problems with opioids in our state? Who thinks it's in the top quartile? You're right. We're actually number 6 or number 7 in terms of incidence of opioid misuse. And then deaths move proportionally with that. So what did Intermountain Healthcare do? So I guess we could have gone to the legislature, and we've got great esteem for the legislature, and asked them to pass bills. Or we could have worked with law enforcement. We've got great esteem for law enforcement, and we worked beautifully with them and tried to help them in some way. But instead, we said to ourselves, what can we do? And so I gave you the statistics about how many of you we are privileged to see over the course of a year. And we realized that based on our size, probably about 60% of the opioids in the community are from us, right? And then we asked ourselves, and we know that the most common gateway to opioid misuse is what? It's not first-time heroin use, right? It's from pills you get from your doctors, right? And so we went to our caregivers, who are amazing folks. And by the way, at Intermountain, we say everybody is a caregiver. Because it doesn't matter to me whether you're pushing a broom, cutting a bill, or whether you're a neurosurgeon, everybody at Intermountain contributes to the health of the community. So we went to our caregivers and we said, we need your help. These folks have taken, over the course of the last year and a half, 6 million pills out of our communities. 6 million. And guess what? We're one of 3 states that has now seen a decrease in deaths from opioid misuse. There's no declaration of victory here, folks. There's a lot of work to do, but that's the way you get things done, particularly in a highly polarized culture. And then tomorrow, up in Park City, we will be having the first ever symposium on opioid-free surgery. Because there are a lot of people, and there may be even people in this room, who've had problems with opioids, and they're scared to death of having an operation because they're like, gosh, I finally kicked this, right? I finally feel safe, and now I need an operation, and the doctors and nurses are going to give me opioids, and what if it starts that terrible spiral again? So we're going to lead out through innovation to try and give people an outlet, and we're having people come from all over the country to learn from us, and we'll learn from them about how do we change the paradigm. Again, don't wait for the government, don't wait for regulation, not going to need any help from pharma, right? We're going to do this ourselves. This is a very Utah pioneer kind of approach to solving really sticky problems. So I'm going to pause here for a second, and I'm going to invite you to ask me questions or make comments. So really good question. How did we go about taking 6 million pills off the street? So we did it in a couple of ways. First, we educated our clinicians. I don't know any doctor or nurse who wakes up in the morning and says, I want to do a bad job for the people I serve. These are the most selfless, intelligent, caring people you could ever hope to meet. But most of us, I'm a pediatric ICU doctor, we practice the way we were trained to practice. And there was a weird, terrible thing that happened in the United States about 25 years ago where people were so worried about pain that hospitals started to get accredited on, they would ask people, did you have any pain at all? And did everyone do everything they could to decrease your pain? And that led to enormous overprescription of opioids. So we educated people, we shared data with the individual practitioners so they could see, am I a high prescriber? Am I a low prescriber? Am I following the national guidelines? Then the third thing we did is we used our electronic medical record, which is not perfect and drives some people crazy, but it changed the default number of pills that people could get in a prescription. And did anybody ever have their wisdom teeth out and somebody sent them home with a prescription for 30 opioid pills? Right? How many did you probably take? 1 or 2? Well, those other 28, your kid's sister could steal them, your neighbor could come in and take them. If you were highly entrepreneurial, you could go sell them. That's a bad thing. I would not suggest that. No one looks good in orange or a jumpsuit, right? So changing those things, Chandler, made just a huge difference. Does that make sense? Other questions or comments? I'm not terminally ill. It's not curable right now. There's a difference in my mind. So I went to swim workout this morning. I did okay. But it's a chronic illness, I hope, for a long time. The question was, how has my focus and perspective changed with this challenge, right? So this actually isn't my first rodeo with cancer. When I was 45, I had bladder cancer. So that was a wake-up call, too. I'd say that as somebody who deals with this problem every day, I wake up in the morning, and I've always been like this, but it's more intense and more focused, is how am I going to make meaning come out of my life today? And how can I make sure that my words count and that hopefully that my words and actions cause greater good than harm? Am I good with my family? Are my relationships in good order? These are things we should all do every day, but I think about them very acutely, but I also don't let them burden me because we have to live. Nobody, I hope all of you lead long, healthy lives, right? But nobody knows for sure. And so I think having some intentionality and some being present in your day-to-day life is a good thing, and I certainly feel that every day. We all get to make choices, right? Well, actually, some people get to make choices. The idea of choosing work-life balance, that's what my kids would call a first world problem, right? So what do? I actually believe more in work-life integration than balance. Some days are all work. Some days are all play. Most days have some work and some play in them. And we think about this and manage this on a day-to-day basis at our house without being burdened by it. I think that check-in with yourself about how you're feeling and what you need That works for us. I definitely fall into the work hard, play hard camp. And look, one of the things about having the challenge that I have is, how much stuff do I want to leave undone, whether it's work or play? And the answer is not very much. And, no matter what happens, I want to leave it all on the field every day.
So you mentioned that you think it's really important to make progress without waiting for legislation. What are you guys doing as far as making healthcare more affordable for people who don't have insurance or are low income?
So let's talk about that for a second. I'll give you 2 examples. The first is pretty easy, I think, to get. The second is really complicated, and it's hard, and this is where some of those balance issues with leadership come in. So the first one is, does anybody think medications are too cheap? Right? Does anybody here know somebody who's actually rationing a prescription medication because they can't afford it? Right. It's actually about between 1/3 and 1/4 of Americans are rationing a prescription medicine, which is disgusting. That may be the only thing I agree with Bernie Sanders on, right? But there's something profoundly wrong with that fact. So what are we doing? Dan Lillianquist, who's our Chief Strategy Officer, came to me my first week as CEO, and he wasn't Chief Strategy Officer then. He said, I have a crazy idea. I think we can start a not-for-profit generic drug company that completely disrupts the bad behavior around pharmaceuticals on the inpatient side of medicine. Because there are all these shortages. We manage about 250 generic drug shortages a month. And we've seen, in some cases, drug prices go up by 1,000 times. And it's usually private equity driven. Somebody will come in, buy up the rights to a drug, drop the prices, drive everyone else out of business, and then they'll jack prices up 1,000 times, also in the context of bad shortages. This is really terrible stuff. So part of being a good leader, I think, is actually clearing the way for people who are more talented than you are. And so I said to Dan, have at it. And we made a modest investment in starting this company. It sounds like a lot of money. It's about $10 million, of which we'll get about $9 million back over time. And you know what? There's now a not-for-profit generic drug company that we helped start. It's called Civica. It's based in Lehi, Utah. 1,200 American hospitals, accounting for 1/3 of American hospital beds, are now part of this. This is in 18 months, folks. 18 drugs are either out there or in the pipeline, and we are seeing the bad actors in generic pharma, who are a minority, but they're there. They are changing their tune, and they're changing it fast, and we're seeing changes in the market already. So this is an example of, don't wait for the government, right? Use the market, use capitalism, but take on the bad guys and do it fearlessly. The number of people who said, they're going to sue you, Mark. They're going to come after you guys. They're going to try and put you out of business. They're going to hurt Intermountain Healthcare. And my answer was, have at it, because we're stalwart in this. And credit to our board, who showed real courage in allowing us to start this. But that's how you make big changes. So that's one example. By the way, Civica raised $55 million in philanthropy, and they're taking on a generic, outpatient generic drugs, the drugs that you guys pay for out of your pockets. That's coming in the next year. Totally revolutionary, and I'm proud that it's a Utah company. The second thing we're doing, and this is where things get really hard. So we are the only major healthcare system in the United States, Intermountain is, the only one that is aggressively working to drop how much healthcare costs for real people, not to pad our margin, but to have people pay less out of pocket. We've identified shoppable procedures that people can, we've dropped the prices. So Normal newborn delivery is down by about a third, about $2,000 price reduction. Still too expensive, making a big difference there. Select Health, the average premium increase in the United States is about 8% per year. We are below 2% in terms of average premium increases. We've put about $65 million back in the pockets of you and your neighbors over the last year. Still not enough. So when we do that, where do you think that money comes from? So I'll give you an example, another example. This is a really discrete one. So we've got some of the best newborn ICUs in the country at Intermountain. And I'm here in Utah County, right? Making babies is a core competency. Let's just face it, right? And we are really good at it, and some of those babies end up in newborn ICUs. Our neonatologists in St. George discovered that by being less interventional, drawing fewer labs, et cetera, that we could actually get babies out of the hospital sooner, healthier, at less expense, right? Less mechanical ventilation, less IVs, less feeding tubes, revolutionary stuff. To roll this program out across all of our newborn ICUs, we were going to make a lot of babies better and save a lot of lives, but it was going to cost our system $50 million in revenue. It's a lot of money, right? Should we do it? This is ethical leadership, right, folks? I mean, ethics and leadership. When I asked our caregivers, they said, you bet we should do it. We have to do it. I think they're right. So where's the $50 million come from? It comes from our existing operations. It has to be more affordable. So what does that mean? It means we've got to be really careful about how we use resources. It means we need to actually change the way we operate so that we can find that $50 million and put it into the bucket where revenue would have been. In a big organization like ours, about 55% of our expenses are, guess what? People, all of us. It's impossible to change the operations of an organization our size and make things more affordable without affecting people. How do you think that makes people feel? Well, if you read the comments section after newspaper articles, not very happy, right? To the point that I've even had the opportunity to have death threats, right? This is hard stuff. Guess how many more projects we have beyond this newborn ICU project that are of the same size, that are yet to be done? Probably 4 or 5. Probably another $200 or $300 million worth of things that we can do for the community and make healthcare more affordable and get better results. But guess what? We're going to need to keep morphing and growing. So what I'm telling you as emerging leaders who I think have immense potential, you need to adopt a change mindset. You need to train yourself how to learn. You need to learn how to relearn things so that you remain viable and vibrant and relevant no matter how the world changes around you. Because I'm telling you that we have an obligation, even though Intermountain is amongst the most affordable healthcare systems in the United States, and people visit us every week from around the country and around the world to see how we do things, that we know we can do better, and we are going to do better because it's the right thing to do. That is ethical leadership. And we're going to do everything we can to help the wonderful people who work with us grow along with us, but it's hard. So let me pause for a second there and answer a question or two. What I can tell you is that the rest of the world looks at us and there's some good literature that's published that suggests if the rest of the United States practiced medicine and kept people well the way Intermountain did, that the overall healthcare expenditure for the US would drop between 25 and 30%, which means there'd be plenty of money for everybody, for new drugs, for new technologies, for reinvestment in the future. But we have worked really hard to align our incentives. This idea that the system stays healthy when we keep people well is super powerful. That's exactly what we should be doing. The rest of the country's pretty well, and that's about 50% of what we do is the keeping people well business. And we're trying to grow that as fast as we can. If you look at the rest of healthcare in the United States, that's in the 5 to 10% range. So the incentives are still misaligned. So those parts of the system do well when they do more stuff to other people. And they're not doing it with poor intent, okay? These are not bad human, but it's misaligned incentives, so it makes it really hard to get healthcare costs down then. So what am I doing? I'm pushing really hard on the national front and talking to my fellow healthcare leaders in really stark, unvarnished terms about how it's their responsibility to get on the value wagon and start to improve quality and decrease cost.
So has the media picked up on the story of, your independent pharmaceutical company? I haven't heard really anything about it. I thought that seemed like it'd be a big.
So it's actually been a pretty huge story, and we almost had, I think when the first story broke, there were literally billions of digital impressions of it. But look, it's out there, but I think there's more to come. I'm not a very deep guy, all right? So I'll start with that. I actually have a very simple lens for most of these things. First thing I say is, what's the right thing to do? I never get all tied up in what's the right business decision. And the corollary to that, and this was more true when our kids were littler, it would be, how comfortable would I be sitting across the dinner table and telling the kids what kind of decision I made that day? And if it didn't pass that sniff test, then I wasn't going to do it. And the good news is the right human decision is almost always the right business decision, and you can almost always make it work. So once you decide what's right, then you can go from there. Is that fair enough? I mean, really pretty simple. Boy, that's a really good question. So the question was, for people who don't necessarily believe that they are caregivers, even if I do, how do you help them connect? And it's really around that connection to purpose. It's really not very hard to do. There's a story from the Johnson Space Center. You may know this story about the guy with the broom. Do you know that story? So this was during the space race, and President Johnson was at the Kennedy Space Center, and he was doing a tour. And at least as legend goes, there was a guy who was sweeping up, and President Johnson said to this guy, "So what are you doing?" He said, "I'm putting a man on the moon." And he was able to connect in his mind, keeping things clean, having things be orderly, having them be safe, and the overall mission. And I think our caregivers and leaders who are here would be quick to say we try really hard to connect each person to purpose. And boy, in healthcare, it's not very hard to do. Really not hard to do. Okay, so one more question for you, or maybe an observation. When you're a leader, when you're a human being, if you see a behavior that is positive and you don't stop and praise somebody and thank them, that's a missed opportunity. right, for sure. Even more impactful is if you're a leader or a human being and you walk by somebody who is failing, maybe on the safety front, on the quality front, maybe more importantly on the being decent to another human being front, and you don't do anything, do you know what you've done? You've created a new standard. So you see a person who is insensitive to another person, demeaning to another person, harsh, bullying, and you don't do anything about it, you have now normalized that behavior. And that, in my mind, is a big problem. So the question I have for all of you is, do you have in your own mind the hills that you're willing to die on as a leader, as a human being, things that you won't tolerate and that you're willing to take personal and professional risk to address? So I'll tell you one that's important to me, and some of you may not like it, and that's perfectly fine. Something that we had never participated in at Intermountain Healthcare was the Pride Parade in Salt Lake City. So we're a wonderful organization. We've got a very diverse workforce, and we serve an incredibly diverse population. But we had always been afraid to participate in the Pride Parade. And afraid because we maybe will get nasty letters, or you can imagine all the things that might happen. And we sat down as a leadership team, and we talked really long and hard about this, and there was a diversity of opinion. Not everyone agreed. And I said, you know, no matter how one feels about LGBTQ plus stuff, we are here to serve people, and we want everybody in the community, regardless of who they are, to feel safe receiving care at Intermountain Healthcare. And by the same token, we know that statistically, a real percentage of our population, somewhere between 5 and 10%, identify on that spectrum, and we want to have those folks feel like they can bring their whole selves to work. And this was a big decision, so I reached out to Scott Anderson, who at the time was just finishing as board chair, and I asked him his opinion, and I asked him what Zions Bank did about this, and he said, oh yeah, we've been sponsoring the Pride Parade for years, and oh yeah, I've gotten some really nasty letters, but we thought this was really important. So that was a hill, you can agree or disagree, right, that I was willing to die on. And so we made the decision, we did it. We had the right to have 250 people march with us based on being a sponsor. We had 800 people who wanted to march, right? Our booth was unbelievably oversubscribed in terms of people who wanted to work and volunteer there. And probably the best thing that happened for me, despite the fact that we had some protesters who shouted nasty things at us, oh well, right? Is I had a woman who visited with me, and she introduced me to her daughter, and she said, this is the first time my daughter has ever done something, where she could be herself. And man, is that, as a leader, to be able to unleash that for another human being, that's really big. So I would encourage you to choose your hills that you want to die on as a human being and as a leader, and then live it. And that's part of that intentionality of getting up every day, and you just decide what that is for you, and try and make the world a little bit better place. So I have just another minute or two with you. I'm happy to take one more question, but I'd love to take one from one of the women in the audience. So the question was, what quality shaped my leadership style? I'm the oldest child, so probably bossiness was probably one. I think that if I'm being really serious, we all have our strengths and weaknesses, and my weaknesses are legion. But one of the strengths that I have is I can have a really crappy day today, and I can wake up tomorrow and feel pretty optimistic. And so some of this health stuff has been a real challenge for our family. It's been scary. But I think Mary Carol and I are pretty good at dealing with it, being realistic, but then shaking it off and getting up and being optimistic and leading life fully. So I'd say that probably is something that shapes my leadership style. And I love people, and I'm really curious. I like to learn new things. And curiosity is not a bad thing to have as a leader because it gives you the opportunity to really try and connect with the people who work with you or for you or who you interact with. Does that make sense? Well, I know that our psychiatric hour is now up. It's 12:20. Actually, I went over by 8 seconds. I apologize. Can I just thank you all for being super present with me today? I appreciate what you're going to bring to our future. And there are a set of people who said, oh, young people these days, and that's never a nice way to start a conversation, right? I, on the other hand, think young people these days, unbelievable. You are our future. I'm sorry if we've messed the world up a little bit. You're going to do way better than we did. And you make me optimistic for the future. Thank you very much.